All right, y'all, it's your girl, Dr. Jen here. Oh my gosh, just found out that you're pregnant. It's your first pregnancy. What do you do? Let's get into it and let's talk about what's next. You finding out that you're pregnant, it's your first baby, and you are super excited, but you just don't know what you need to do next. Contact your OBGYN, or if you have not found one, get recommendations, look online, etc. Get an OBGYN that you feel like you'll be comfortable with and make an appointment for you to be seen. When you get in for your appointment, really we go over your entire medical history. Find out what medical conditions exist for you. If you do have medical conditions, what are those and what medications are you taking? There are certain medications that are not safe in pregnancy and can cause for the fetus or your baby, as we call it, to have some abnormalities. Going over your family's medical history. So are there genetic abnormalities that are in the family? Do a lot of family members or have congenital heart defects? Things of that sort would then lead for us to need to do specific testing on your baby later on in the pregnancy. Other things that need to be done as well is just the routine screening. So are you up to date on your pap smear? Are you up to date on your immunizations? And if not, can you get that vaccine now, or does it need to wait till after pregnancy? So vaccines, of course, that cannot be given during pregnancy is the chickenpox vaccine. The varicella vaccine should not be given. MMR should not be given during pregnancy. The HPV vaccine should not be given during pregnancy. And there's a list of others as well. But Tdap can be, and that's normally given around 27 weeks. So just going through that, seeing what you can and cannot take. And if you haven't been vaccinated towards chickenpox, or you haven't gotten the measles, mumps, rubella vaccine, kind of discussing with you if there is a concern that a family member, a little kiddo, has gotten chickenpox, being sure to stay away from them. It's very contagious and can cause complications for your health and the baby's health as well. And then last thing is kind of just talking through what to expect in the normal stages of pregnancy. So how much weight should you gain during pregnancy? The normal weight that someone should gain during the pregnancy is between 25 to 35 pounds if you are in a BMI that's considered normal. So I always tell my patients, you are eating for one person. You are not eating for two people. What you eat, your baby's going to snatch from you. And everything you eat, everything you consume, your baby will take from you. So make sure that you're eating a balanced, healthy diet, and that is going to be the best way to keep your baby getting all the nutrients it needs to grow and be strong. This is a food documentary right here that I recommend to almost all of my patients. We know why we should be healthy, why we should eat healthy, but not necessarily how. And I think this does a great job of explaining how exactly we can implement those changes. Also, with your baby snatching everything that you consume from you, that means alcohol, that means tobacco, and that means other substances. So of course, alcohol use is not recommended in pregnancy, not even a glass of wine. There's something called fetal alcohol spectrum disorder, where your baby can have mental delays and sort of developmental abnormalities, even with its physical features, through alcohol use. And there really isn't any dose of alcohol that we can say is considered safe. Any amount of alcohol can lead to this disorder, so we recommend that you discontinue use. Tobacco use can cause for you to have a miscarriage, have a low birth weight baby, for the placenta to detach, which is really baby's lifeline and helps to keep baby growing and get the nutrients that it needs from you, and even something called sudden infant death syndrome, SIDS. So it's recommended that you discontinue tobacco use. And then, as we know, for other substances, most of them are illegal, whether you're pregnant or not pregnant, so discontinue any of that use. So other things that are recommended as well is to be physically active. Eat healthy, but also be physically active. So let's say that you were an Olympian and you can lift a large amount of weights and run long distances. I wouldn't say that you need to now just revert to just walking. You could probably do a little bit more because you have been trained to do so. So I always tell patients, go based on your level of athleticism. If you had been able to do more before pregnancy, it's probably still okay and safe to be able to do a little bit more rigorous physical activity, but of course, avoiding like contact sports, anything that can hit the belly and cause a problem with the pregnancy. If you lift heavy weights, trying to avoid lifting really, really heavy weights that could accidentally drop on your belly. Those kind of things. Contact sports, recommend that, staying away from those. But at baseline, walking, brisk walking, about 30 minutes 5 times a week is recommended if you had never really been physically active before the pregnancy. Other things that are recommended as well is, of course, take your prenatal vitamin. And then also in the early stages of pregnancy, morning sickness, it is real. So making sure that you are taking like ginger capsules and ginger teas can help with preventing that nausea and vomiting. And then of course your OB can also prescribe you nausea and vomiting medication. And then also I always recommend like acid reflux medication, because a lot of times the two go together. The last thing that we also do as well is just to get general blood work, to know what your blood type is, what is your hemoglobin count, kind of getting these general labs, doing STD testings, etc. is what we do during that first visit. So I hope to see you guys in my office if you live in the area. But if not, I always say try and find a provider who you feel like is meeting your needs, who is hearing out your complaints, and you guys are, through shared decision making, coming to an agreement on how to proceed with your care. So I wish you guys all the best of luck with your pregnancy.